If you're over 70, there's something your doctor may never have mentioned, and it could change the way you think about routine medical checkups. Millions of seniors walk into clinics each year believing they're protecting their health, but end up agreeing to tests that quietly do more harm than good. Today, we begin a countdown of the most common medical tests seniors should be cautious about. So, before we dive in, how old are you and where are you watching from? Drop it in the comments below. Let's start with number 5. Bone density scans, also known as the DEXA test. At first glance, it seems harmless. No needles, no recovery time, just a quick scan of your bones. But here's the hidden truth most seniors never hear. After age 70, almost everyone shows some level of bone thinning. It's as normal as gray hair or wrinkles. But the problem begins when these results cause fear, and seniors are immediately prescribed strong medications like bisphosphonates. These drugs often do more harm than good. They're known to cause jaw deterioration, painful esophagus inflammation, and even brittle fractures, all because the medication oversuppresses your natural bone turnover. A 2022 study following more than 1,200 women over 70 found that treating mild bone loss reduced fracture risk by only 0.3% in 5 years, virtually no benefit. Meanwhile, complications skyrocketed. Here's the good news. Most seniors with mild bone loss don't need medication. What they need is movement. Research shows that resistance training, balance exercises, vitamin D, and calcium-rich foods can reduce fracture risk by over 20%, naturally and safely. So, unless you're experiencing frequent falls or fractures, don't let a scan scare you into lifelong medication. But this is just the beginning, because the next test on our list goes far beyond fear. It can create confusion, panic, and unnecessary follow-ups that make life harder, not healthier. Let's talk about brain MRIs for memory loss. Have you ever misplaced your keys, forgotten a name, or walked into a room and wondered why you were there? For seniors, these small lapses often trigger a terrifying thought. Is this Alzheimer's? That's why so many older adults request a brain MRI hoping for clarity. But here's what most don't realize. In adults over 70, brain MRIs rarely provide helpful answers. Instead, they often create fear. A major review of over 3,000 seniors aged 70 to 85 found that 86% of scans showed abnormalities. Tiny white spots or shrinkage that sound alarming, but are completely normal signs of aging. And here's the shocking part. Only 3% of those findings led to an actual treatable diagnosis. That means 97% of seniors were scared, stressed, or sent for additional testing for results that didn't matter at all. Once an MRI shows something abnormal, even if it's harmless, it often triggers a cascade. Spinal taps, biopsies, new medications, or even surgery. Each step carrying more risk, more fear, and more confusion. Here's something every senior should know. Mild forgetfulness does not mean dementia. It's often caused by dehydration, poor sleep, stress, medication side effects, or simply normal aging. Your brain is changing, but that doesn't mean it's failing. It's adapting. A far safer first step is a simple cognitive screening test. No radiation, no sedation, and no risk. Yet it gives a clear picture of your memory and attention. So before rushing into an MRI, remember that not every lapse needs a scan, because the next test on our list is even more surprising. A heart test that's supposed to save lives, but in seniors often leads straight to unnecessary surgery. Most seniors believe that a cardiac stress test is a great way to check their heart and prevent heart attacks. You walk on a treadmill, doctors monitor your heart. Simple and safe, right? Not exactly. Research published in JAMA Cardiology reveals a shocking statistic. Up to 40% of stress test results in adults over 70 are false positives, meaning the test says there's a problem when there actually isn't. And here's where the danger begins. False positive results often trigger risky follow-up procedures like angiograms, stent placements, or even bypass surgery. A 2017 study found that more than half of stents placed after stress test referrals provided no real benefit. No improvement in survival, no improvement in quality of life. Instead, these unnecessary procedures can cause bleeding, kidney injury, infections, and long hospital stays, all starting from a test that never should have been done. So when should seniors get a stress test? Only when there are clear, meaningful symptoms: chest pain during activity, shortness of breath climbing stairs, or a sudden drop in stamina. Without these symptoms, the stress test can do more harm than good. Instead, consider safer, more accurate tools like a resting EKG or a coronary calcium scan. These detect real issues without the high risk of false alarms. If you're finding this information helpful, hit the like button and subscribe, because the next test we're about to discuss is one almost every senior has undergone, yet its risks increase dramatically after age 70. Colonoscopy is one of the most common screening tests for older adults. It's often seen as essential, a life-saving procedure to catch colon cancer early. But after age 70, and especially after 75, the risks can outweigh the benefits. Most seniors don't realize how hard the preparation can be on the body. The powerful laxatives used for colonoscopy prep can cause severe dehydration, kidney stress, dizziness, and even fainting. Then comes sedation, which, for older adults, can trigger confusion, memory problems, and irregular heart rhythms. These are serious concerns that often go unaddressed. A 2019 JAMA internal medicine study tracked 1.3 million Medicare patients over age 70. The results were surprising. For every 1,000 colonoscopies, only 2 lives were saved, but 20-plus seniors suffered serious complications, including bleeding, perforation, or sedation-related issues. This represents a stark 10-to-1 risk-to-benefit ratio. Take Dana, a healthy 73-year-old grandmother. She had no symptoms, yet her doctor insisted on another colonoscopy just to be safe. A harmless polyp was removed, but that night, she collapsed with severe abdominal pain. The procedure caused a bowel tear. She spent 9 days in the hospital, all from a test she didn't need. The good news? There's a simple, non-invasive at-home test called the FIT test, which detects blood in the stool and catches up to 90% of potential cancers, without sedation or hospital visits. This offers a much safer alternative for many seniors. And the U.S. Preventive Services Task Force recommends stopping routine colonoscopies at age 75, unless symptoms or major risk factors exist. This guidance helps ensure appropriate care for older adults. But the most shocking test of all is still coming: a full-body scan that promises peace of mind but may actually raise your cancer risk. Stay tuned to learn more about this critical topic. Imagine a test marketed as the ultimate reassurance: a full-body CT scan that claims to find hidden diseases early. But what if that very scan was quietly increasing your cancer risk? A 2023 study in JAMA Internal Medicine found that radiation from CT scans now contributes to up to 5% of all new cancers in the U.S. And full-body scans are the worst offenders. Each scan exposes you to radiation equal to 500 chest X-rays. But the danger doesn't stop there. Full-body scans often reveal harmless, age-related findings: little cysts, nodules, or tiny spots that mean nothing. Yet once they're seen, doctors must act. That leads to repeat scans, biopsies, invasive procedures, collapsed lungs, and infections. All for conditions that never needed treatment. Take Marcus, an 80-year-old retired teacher. A full-body scan found a tiny lung nodule. The biopsy came back benign, but it collapsed part of his lung and sent him to the hospital for weeks. He survived the biopsy, but not the fear it created. The American College of Radiology is clear. There is no proven survival benefit to full-body CT screening for people without symptoms. If you feel healthy, listen to your body. Use targeted imaging only when symptoms appear. Here's what seniors should be cautious about after 70. Bone density scans, brain MRIs, cardiac stress tests, colonoscopy, full-body CT scans. These tests may sound routine, but often cause more harm, anxiety, and complications than help. Remember, less testing doesn't mean less care. It means smarter care. Your goal isn't to chase diseases that don't exist, but to protect your health, your peace of mind, and your well-being. If this video helped you, please like, subscribe, and share your story in the comments. You're part of a community that believes aging isn't weakness. It's wisdom in motion.